So if someone came in here with a diagnosed concussion, how would you treat them different at the CIIT Center than another doctor in another doctor's office?
So concussions are extremely common. They happen all the time. And thankfully, many of them just resolve spontaneously. You know, give it some time and rest and so on, and the symptoms will go away. Usually headache, dizziness, blurry vision, things along those lines. But unfortunately, in 20 to 30% of those patients, they have persistent symptoms that just don't go away. And despite the rest and the reduced activity in sports or school or any of those things, they have chronic persistent symptoms that seem to get worse. So that's called post-concussive syndrome. And from our perspective, that's a very important thing to address. So what we do is look at them from both a functional medicine and functional neurology perspective, and actually come at them with therapeutic strategies to reduce those problems. Left unchecked, these things just get worse. They never get better. So what we want to do is make sure that this patient doesn't have ongoing chronic inflammation in the brain that can then lead to neuroinflammation and then neurodegeneration. And eventually these people who have chronic post-concussive syndrome have a really significantly increased risk for anxiety and depression and other chronic neurological disorders. So we want to make sure that we nip it in the bud and make sure our patients resolve totally.